Thank you for this opportunity to speak on behalf of my country, Suriname, but also on behalf of the pro-temporary presidency, which Suriname got in April during the Jefe de Estados meeting. That was in April. Now, a few weeks back, Peru came and we had the technical transfers of all the councils of Unasur. In that instance, Suriname took charge or co-charge of 5 councils. Amongst one is the Health Council. We are going to lead the Health Council for the next year. We are very grateful and happy that we can do that, because it will give us an opportunity to give a Surinamese flavor to the Unasur Health Council leadership. Of course, one of our priorities will be to organize a Health Council meeting. Countries have already approached us that if we can do that within a short amount of time. Last week in Buenos Aires, we had the second face-to-face meeting of the Universal Access to Medicines group, and there I had the opportunity to talk some with Argentinian officials, and here I've been able to continue some of my talks with Brazilian officials, because we need to do a health council in the beginning of 2014. We hope it can be in February. We need to define an agenda. We need to set some priorities. We had a very ambitious 5-year plan, but we have to see how we can condense that and make sure that we execute it. Of course, we will take the opportunity during our presidency of the Health Council to walk arm in arm with our neighboring country, Guyana, as we are one of the 3 non-Spanish speaking countries in Unasur, and Brazil speaks Portuguese, which is very close to Spanish, but we are Dutch speaking, Guyana is English speaking, so for us it is sometimes a challenge to participate fully in Unasur activities. We are very grateful that Isaacs has been helping us and is holding these sort of trilingual conferences that are being held now. We also want to see how we can improve on the efficiency in which events are organized. Unasur is very active, but not all the groups are going at the same pace, which results in some duplication of efforts, and on the other hand, not enough is going on. One of the unique things that happened when I was in Paramaribo, our capital city, a few weeks back when we had the technical transfers, is that we had an opportunity to hear from the other councils what they were doing. And one of the things that I clearly remembered was that there are some councils which are doing things that are health related. Amongst them was the Council of Science and Technology. So it is very good that at this event, ministries of science and technology or which are holding that portfolio are also here. But they are doing things with telemedicines, which is very important to achieve equity in health, especially for our indigenous populations. Some people are doing things with production of medicines. A gap analysis is being done by the Science and Technology Council to see how they can gear investigation towards those gaps, identified gaps. Now we think that we can work with them to sort out these problems. So during our presidency, we will take the chance and the time to do those things. That is in terms of the pro-temporary presidency. It's a big challenge for a small nation like ours, and we are grateful for all the help that we can get. from nations that have more experience in this. But we still think that we can bring our own experience. We have been a long-standing member of CARICOM. We think that we can bring our experience to deal with smaller nations into the Unasur constellation. Well, I think I saw you talking to the Argentinian coordinator, Tomas Pipo. We have been working together for a long time now. Pre-Unasur, there was already a group of countries that used to talk a lot when we were dealing with common positions in the WHO and in the PAHO. And that is why I think when the Access to Medicines Working Group started, we could immediately establish an agenda, what we wanted to do, because there are some common issues that affect all of our nations, despite the differences in political systems and ideologies that we may have. We are all dealing with ever expensive medicines. We have seen here that biological medicines will take up a big portion of our budget. We do realize that we cannot depend entirely on the production capacity of the North. We have seen that when we had the vaccine issues. So we are doing projects. I think Thomas Pipo talked to you about that. The two projects, one is the pricing bank, one is an inventory of the production capacity and the medicines policies of the regions, which will result in us having a better view of what is going on and to have a certain amount of self-sufficiency when we have to ensure that people of our region have an increased access to quality products to lower the mortality rates of our people. So we talked about that. We talked about the common positions that we need to adopt in PAHO and WHO, very important. I've already sent a few documents yesterday from that meeting to my boss, who is now dealing with them as the pro-temporary presidency. So we are going ahead in full steam. Very happy to be here in Brazil. Grateful that ISAACS is doing what it can to increase the capacity in the region. We will work with ISAACS to align our agendas more. I think that is something very important. It is something that the Unasur Secretariat in Ecuador has asked us to do during our PTP. So that's really what we are going to do.
Thank you very much.
You're welcome.